What happens if, for example, Botox is administered incorrectly? What are the consequences for a patient? Hey, how's it going?
We're back.
With a topic that you all ask us about a lot, talking about aesthetics, Botox, fillers, and injectables. A lot of people have questions and always ask us for recommendations for doctors. Aesthetic specialists who speak Portuguese, right? James?
Exactly. And today, we came to a really cool place here in London to show you everything.
We're here in Chelsea, in the Chelsea neighborhood, at the Chelsea Bridge Clinic. And we came to talk to Dr. Gregorio. Gregorio is going to tell us everything about Botox, about fillers, about injectables.
No, he's not just gonna talk. Everyone said he's gonna leave it like that. He's gonna do it. Botox, right? She's already beautiful. That's it, doctor.
But I'm going to get rid of my wrinkles, okay? Let's see. If you want to get to know Dr. Gregorio and his work a little, we came here.
So let me introduce Dr. Gregorio to you all. Go ahead, doctor. How are you?
Hello, how are you? Welcome.
And he even speaks Portuguese, guys. So if you're looking to get any kind of aesthetic treatment done, Dr. Gregorio does several procedures, right? Doctor?
The aesthetic procedures we can perform on a regular patient depend on the pattern of muscle movement, on muscle symmetry, and on various facial factors. We can do fillers, facial harmonization, Botox.
And how long have you been working with this, doctor? Just with aesthetics?
Since 2012, I've been doing aesthetic treatments.
But before that, several things.
Back then in the field of medicine, I did general surgery, oncology. I also specialized in reconstructive surgery, and I worked with ultrasonography and emergency care.
And why did you decide to go into aesthetics?
Out of passion. I'm passionate about anti-aging treatments, about stopping the aging process.
Is it possible for us to stay young forever?
It is possible. Nowadays, there are Nobel Prize winning studies that show, yes, it is possible. There are ways to stop the aging process. There's already a Nobel Prize, and there's an American woman who made this discovery. And in Brazil, for example, in Rio de Janeiro, there's a center where they use adipose cells to fill in muscle. So if that's possible, then it's possible for the aging process as well. There's another doctor who was my professor in Madrid, Dr. Jesus Teresgueras, who is an endocrinologist, and he has a study on the aging process through internal endocrinological mechanisms, melatonin growth hormone.
And here in London, doctor, how long have you been working here?
I've been here since 2014.
And you were telling me that you see patients of all nationalities here.
There are several. Here at this clinic I see Arabs, Russians, Turks, English, Portuguese as well, Brazilians.
Are Brazilian women the ones who seek out aesthetic procedures the most?
They are looking for.
Is that really true?
Or Latinos in general.
And do you think that Brazilian women or Latinas who seek out more aesthetic procedures have gone overboard? Are they doing too much? Is it too artificial already?
Usually, it depends on each person's standards. For example, if they're happy with how they feel, they can do it. But by my standards, nowadays that's not done anymore. Like in the past, for example, people would get botulinum toxin treatments and end up with a paralyzed forehead. No movement at all, no expression. This is something that's been left behind. Nowadays, people go for lifting treatments. For the eyebrows, a natural arch with a natural movement pattern, following the individual movement pattern of each person. So that's what the doctor who specializes in aesthetic and anti-aging medicine tries to do.
Nothing too artificial, you don't have that question.
Where there's no movement. So that's the standard that's been left behind. Nowadays, we try to make it as natural as possible.
So the time has come, right? I'm going to have a procedure done today and the doctor is going to get me ready. First, he'll explain what he's decided to do. We were taking some photos here, doing some studies about my case. The doctor told me it will take about 10.
But can you show us more or less? Look, he was using the ruler, moving it up and down. There, let me see.
We're gonna have to use a vial like this one here. Look, from Dr.
Oops. Oh, my God.
Look, I was just doing the case study. We took the photos and then he started showing me some points that he can't touch. Other points that he will work on. That he's gonna do some of those tricks. You'll see the result.
Doctor, what is that? Is that the anesthetic? Is that it?
Hey, I don't want to have it anymore.
You can already feel the effect of the anesthesia. I'm already prepared. The doctor applied an anesthetic and a plastic cover to let the anesthetic take effect. You don't really feel the needle pricks much, right, doctor? So, we've told you a lot, talked about a bunch of things, chatted with Dr. Gregorio, but we still haven't said what treatment I'm going to have we?
We're going to do a facial lifting with botulinum toxin.
A facial lifting. I'm fancy.
Yes, with botulinum toxin, commonly called Botox.
No, and I had never done any treatment before, not even just Botox. Forehead, which had all these people. See how important it is to look for a professional? The doctor was explaining a lot to me, because it's not just about going in and injecting, no. The forehead, which I wasn't even used to doing. You need to measure... He measured my forehead, took several photos, is going to do the markings, and is using anesthetics so the patient suffers less. So there's a lot of care involved. I've already done it, doctor. Botox. Where the person wasn't even wearing gloves.
My God.
Risk of contamination, infection, big time.
So, I'm all set here. Just have to wait a little longer. How long?
Just 10 minutes.
I'm already feeling my mouth tingling.
Yeah, that's good. So if you don't feel...
No, it's numb. No, everything is completely sterilized. All set, now I'm all marked up. And from what I was observing here, doctor, you did exactly what you showed in that drawing with the photo, right? And what is this treatment? What are we going to do? Because the whole bone is covered in marks.
You need to have a lifting treatment with strategic points to enhance your beauty. To do a proper brow lift, preventing the hemifisto effect, which is that raised eyebrow in this lateral area. Raise your eyebrows for me. You have a very hyperactive forehead, and we need to try to protect, not block this area, because each little point we make is where the muscle will be blocked.
I see. So this here is the mark of what will be blocked? No, it's what you need to protect.
Yes, to have a well-shaped eyebrow.
And doctor, we often talk about the benefits of getting Botox, for example, for anti-aging prevention, and also for aesthetic reasons, Botox. We know it's also used for several other conditions. For example, people who sweat a lot. So Botox has several benefits, but what happens if a Botox application, for instance, is done incorrectly? What are the consequences for a patient?
There are several risks. For example, if you do an incorrect application, in this area here in particular, there's a risk of causing ptosis. Ptosis means that this muscle becomes inhibited, paralyzed, blocked, and the eyelid ends up like this, drooping.
I can't lift it.
It doesn't stay lifted, and the eyelid can stay drooped for quite a while.
And there's no way to reverse it. I would have to have surgery. Would the toxin be eliminated?
There's no antidote. It wears off in 3 to 4 months.
So, in the case of this procedure that I'm going to have, does the toxin last on the face for 3 to 4 months?
It depends. It depends on the supplier of the toxin, on storage and the protein. If the toxin isn't stored properly, at the right temperature in the right place, it affects the duration.
Of the effect of the blockage.
If it was left out of the proper temperature for a while, the toxin becomes ineffective. Other times, when you use a toxin that has already been reconstituted, you took the vial, reconstituted it, stored it in the refrigerator. It's stated in the guidelines that after more than 24 hours, the toxin's effect is reduced. I see. So, it should be used immediately. It's meant to be used right away, not to be left, stored, or used later. You shouldn't use other vials.
I see. And this one on the face, what effect does it have?
This is a platysma lift, which involves the insertion of the platysma muscle. What it essentially does is pull downward. And when we block these strategic points here, it lifts this area, and the published literature clearly says it improves the lines here.
Of the neck, it improves the lines on the neck, so the treatment can also be done on the neck, for example, to prevent the bands from going up.
Yes, you can treat the entire platysma band. But when you do it like this, the neck's like this, you can get rid of these lines here. But in your case, working on the jawline is a better option. Each treatment is individualized, each patient.
You can't repeat my treatment on someone else. Each patient has a...
It's a different pattern of movement.
You see? Don't try to get lips, eyes, or eyebrows like that actress or this or that person. Do what's best. Everyone can improve what they have, since age is coming, right? So let's go, doctor. Let's get started, right? And it's not pretending.
Nothing. Bring the line back. If it's at the white part of the eye, it's all good. You finish cleaning up here, but you can see it right away. Your face is already different.
So now he's going to do another treatment on the whole face to close the pores. It's also with botulinum toxin. And what is the other one?
It's with botulinum toxin. And if that's not it, well, could it be? What is it, doctor?
This one is vitamin C.
Can't you massage it?
I can massage the area. Also the serum, the antioxidant. It helps with those fine wrinkles. And since we did that technique on your skin, we help to prevent them. When you had Botox for the first time, did they do this? Nothing. It's just tap, tap, tap. Thank you. Bye. Thank you.
Thank you so much.
Another face. No, you don't even need more makeup. Here is a cellulose mask. This is to take care of the general area because you need to give it a little relief.
But there's no such thing as an ugly woman. There's just a woman without a plan. Look at that. Spend a little money and you're good to go. No, it's an investment.
It's an investment, right?
I think taking care of our self-esteem is an investment. And that's why it's important to do it with a professional so you don't mess yourself up. But women know that when we're feeling good, right, doctor? It seems like everything starts going right, we're doing well. Yes, and at other times, psychologically, we have to be more capable.
Yes, it involves many factors. You see yourself as more attractive, more shaved, more appealing, and your self-esteem gets a boost. And that can be achieved in many empirical ways. What are the tips for making the treatment with toxin last longer? Actually, it's not really about making it last longer. It's more about keeping those lines finer and improving the effectiveness of the skin. If you smoke and change, I can prove that there are no habits. And to stop smoking, sleep well with a sense of longing and apply moisturizer from the brand you prefer as well as sunscreen. In other words, I understood that I can extend it a bit more overall, and you can also use a mask.
You already look beautiful, your lips are full. And it wasn't even lip filler, it was just Botox and it made a difference, even in this outline here, right?
Yes, does the son also come to see if he sees me?
Only a professional knows how to recommend the correct procedure. The inspection has already been done. The skin, as Abraham says, is tighter than a pool table cloth, right, love? It's really. But it's true, I can't even lift everything anymore. Here is the maximum, but it is 15 days. So just wait, you'll see the results. So guys, 15 days later, we're back. And there? What do you think? We're going to show you the before and after photos with Dr. Gregorio, but I can already see a huge difference. Do you think we need to have a full talk about it? Let's see with a medical evaluation, right? Because Dr. Gregorio is the best person to talk about it. But honestly, I'm already impressed with the result. I already like it. I want you to do this every month. So let's go. Let's get started with this. And look where we are already, just so you can see. That's Chelsea Bridge over there. And on this side, here you can already see the clinic. Guys, now I'm already here with Dr. Gregorio. He said we still need to fix a few little things. But Dr. Gregorio had already told me that we were going to do a booster, a touch-up. Because this side of my muscles is stronger. So he already knew. But look at the difference between this photo and how it is now.
1, 2, 1.
Pressed. And now he's showing me that we're going to take some new photos and he's going to mark it as well. That's not even the same person. Wow, I didn't have this photo from the side. Look at this.
We also did a platysma lift.
Just look at that. Here, it used to stick out. Is there one from the front? Look, now. And I'm flexing. And everything, right, doctor, was done with Botox, this lift?
Yes. Which botulinum toxin?
It usually lasts for about 3 to 4 months.
It depends on the person's activity level.
It depends on the activity.
It depends on the immune system. It depends on the type of activity you do.
Yeah, the doctor explained to me that in my case it would be 3 to 4 months because since I do a lot of physical activity, I use my facial muscles a lot. So ideally in 4 months I should come back to do it again so I don't get back to that state, right? And besides saving money, because since the face won't be completely in that state,
You use less product, pay less.
lower cost. And you maintain a more youthful appearance. And today, doctor, what are the plans?
Now we're going to do some planning with new photos to see her kinetic structure, because right now she's not hyperkinetic. Right now, kinetic movement isn't good. And there's a slight upward movement in the eyebrow, and we're going to adjust that level, that movement.
It's this right here, you see? And it's not that it's wrong, doctor. He had already warned me because this muscle of mine, this side, is much stronger. So, since this is my first appointment with the doctor, he applied a certain amount and said, let's evaluate to see how your body responds to the botulinum toxin. So, today he's going to do it 15 days later to fix this here. Honestly, doctor, I would already be happy just like this. I was great, I'm already happy.
Before it looked good, but this contour here was flat. Now, the contour looks good. It's perfect for creating a line. When you do this or do a filler, it stays like this, just like that. And to improve this area here, this fat shifted from here, so it moved over to here. We fix and reposition that fat and treat this ligament here.
And then would this line go away?
It stays like this.
Last time the doctor even destroyed his pen. He ran out of ink, guys. There were so many marks. Dr. Aiko, at what age can someone typically begin undergoing this treatment?
Normally, it is recommended from that other year. 18? 18. As a preventive measure.
As a preventive measure. And then, for example, what would be the interval between one application and another?
Apparently, according to medical guidelines, it's up to 60 years old. But in my personal opinion as a doctor, it is until you have strong muscle movement. Regardless of age, that's what matters. But as a recommendation, 60 to 73 years old is the maximum age to use botulinum toxin. It makes sense. It's because there isn't much muscle strength and there are a lot of deep lines. But if a patient comes in who has been undergoing treatment for years, and let's say they're 70, but they come in regularly for touch-ups.
I still have that, in Gonçalves' chair. Oh, doctor, I want to do it too, doctor. Look at this. Look at my forehead. My God, it's already like this, just like before. You know, Professor, this right here, it's anesthesia. I mean, an anesthetic shot? But we're all just going on willpower. We're scared. Look, squeezing the little ball. You gave the example of a painter. You just, focus here on the little ball. Yeah, Diego. How old are you? 22. See? He doesn't even remember anymore. He even changed his age now. You see, before it was before 40 years old, now it's 22.
Show a little. Always with your life. He is the Salura toxin autolytic, and this is the cement treatment, and this is the lute. And one day at a time.
See? The doctor shows you everything when you come to do it. Everything is super prepared, everything sanitized. And if you say you saw it on Vibe, the evaluation consultation is free. Okay? All the details are in the video description. There you go, folks. If you want to know more,
Everything is on Instagram, Dr. Gregorios, Medical Gregory. It's here in the description. Take a look there because that's where you'll find information about the treatment. We're also posting photos of my treatment on Instagram, doctor, so you can follow along. Everything is there. It's very important for the patient not to panic and to wait the 14 or 15 days after the first application, because the membrane needs to be fixed with the protein from the botulinum toxin. Besides that, the doctor will assess the symmetry of the patient, and that's when he can adjust the patient's kinetic movement.
You understand?
That's the recommendation. If a colleague is watching this video, that's the recommendation. Don't do it before 15 days.
Yeah, don't panic if you don't see your results before 15 days.
Yeah, because people will come in, and if they're not 100% in a week, they'll get upset. No, doctor. No, but if you wait 7 days, I saw a big difference at 15 days too.
For doctors, this area here is a bit delicate when you apply botulinum toxin, because if you inject too close to the dorsum, there's this muscle here that's connected to the upper lip. You can create asymmetry if you don't inject properly, or the patient can end up with a drooping smile. So you need to be a little cautious and inject right on the nasal dorsum. Or depending on the patient's movement pattern, the nose drops when they move. In her case, she has this movement pattern, and here it's very close. You can see it clearly here. It connects here and can cause muscle asymmetry. If I freeze this muscle here,
It just ends up being nonsense. It's a joke, it's a joke, it's a joke.
this muscle here, if you block it, it causes asymmetry when you smile. This is more for doctors. So it's more for the professionals.
I think it's for everyone, you know? It's best to do it with a professional, because sometimes, right, any little mistake that happens when you go to someone who's not a professional, the risk is really high that something could go wrong. A long time with your body deformed.
Normally you apply it here on the dorsum, on the sole.
What's going on? Is everything okay? And then he applied it. Soon, you have to mention the neck meat, tough meat. Who can handle that? Tough meat, then it's okay.
And whatnot? No, it's not called that, it's called votes. This procedure is to close the pores of the skin, which, as they know, gives it a smoother appearance.
And just look at the result here. Guys, look at how the service here is different, because out of all the places I've been, I've never seen a skin treatment like this after doing the botulinum toxin. So, doctor, thank you. Is there anything else? Is there anything you'd like to say?
I prepared myself at the beginning. You shouldn't exert yourself for the first 4 hours. Stay calm, take it easy, and we'll see each other next week to make sure everything is all right.
So that's it, everyone. Don't forget to follow Dr. Gregorio. All his information is right here, in the description and also in the video. Book your appointment or evaluation if you want to see, experience, and get to know Dr. Gregorio's work. If you mention that you saw it here on the vape, the evaluation is free. So take this opportunity to take care of your skin, your health, and your self-esteem, because it's really important for us. Because here in England, right, doctor, we work so much, and taking care of ourselves is really worth it, isn't it? Absolutely.
And after this, now is there a way, since you mentioned this house face that's kind of a mess, right? There's a way, so that's great, guys. If you liked it, leave a like. Subscribe to the channel and turn on the notification bell, because every week there are 2 videos, and
We'll see each other again, as always, in the next one. On the vibe, 10 years younger now. And thank you so much.